November was National Bladder Health Awareness Month, so we hope you feel the urge to get educated about it. And certified registered nurse practitioner Heather Williams is in studio right now to talk to us. How are you doing today?
I'm great, Sheldon.
Okay.
How are you?
Yeah, I'm doing fantastic. Now, we're talking about the bladder. The obvious first question is, what is it?
So the bladder is a sac-like organ that's located in the lower portion of the abdomen or the pelvis. Its purpose is to hold and retain urine that's been transported from the kidneys until it's time to be expelled from the body. Men and women of all ages, they can have bladder issues at any point throughout their life. And it can affect their quality of life in regards to emotional well-being, their sexual health, or daily activities.
Yeah, so it is important. We gotta have it. Okay.
Absolutely.
So when it comes to the bladder and either treatment or getting tests, sometimes people get a little embarrassed by it, and they will prolong going to see the doctor or get those tests done, or have some fear. What do you say about that?
So yes, completely understandable. Oftentimes, both men and women may be fearful, embarrassed, and a lot may have to do with the concerns regarding the invasiveness of the diagnostic tests and procedures. The good news is not all tests and procedures are they're not invasive per se. So when there comes to a point where there is some invasiveness that needs to be involved, oftentimes we hear our patients, both men and women, say, hey, this wasn't nearly as bad as I thought it was. So the anticipation can often be worse than the actual event itself, which is why I cannot stress enough that if you are having problems, any pain with urination, discomfort, blood and urine, get it checked out.
Yeah, and I agree. And I get that you all might be feeling that way as well. Just remember, I had prostate cancer. I got on TV talking about it. So let's put that embarrassment or fears aside.
Right.
And when it comes to things that can keep our bladder healthy, are there things that we can do?
Absolutely. There are several things that we can do to keep our bladders healthy. To name a few, I would say start by trying to empty your bladder every 3 to 4 hours. So if we hold our urine in our bladders for extended periods of time, over that time frame, it can weaken the bladder muscle. It can put us at risk for bladder infections. It can contribute to urinary urgency, frequency, leakage. What we eat, what we drink can play a role in it. So citrus fruits, carbonated sodas, juices, artificial sweeteners, all of that can affect our bladder. So I would say dietary modification would definitely be beneficial. Water intake is helpful as well. The amount of water that we need, it can vary on our body type, our body size, our activity level, and where we live. So if we live somewhere that's hotter versus colder.
Yeah. Signs that we might have a bladder issue are?
So signs that we may have a bladder issue would include blood in the urine, persistent urge to urinate, frequency, urinary leakage, pain, to name a few.
Yeah. What can cause some of these issues? So you talked a little bit about if we wait too long, there's got to be other issues that could cause it.
Right. So what can contribute to it as well? So again, many bladder issues are caused by bacteria being within the urinary tract. Oftentimes we may have blockage within the urinary tract, previous exposure to radiation, allergic reactions, plethora of things.
Yeah, treatment, what kind of treatment is out there to do?
So treatment would depend on exactly which issue you're having. So, and that can depend on the severity of your symptoms. So that's when it comes into play with, excuse me, notifying your healthcare provider so they can investigate what's specific to your individualized plan of care.
Yeah, a lot of information right there, folks. Heather Williams, a nurse practitioner. We certainly do appreciate it. Thanks so much for joining us today.
Thank you, Sheldon.
Great job. We'll be right back.